Sina, thank you so much. So, I was very happy that you invited me. I remember asking you, do I even need a presentation? Maybe I can just talk about the stuff in clinical terms. And you're like, just put something together. So I did put something together, but it's not as fancy as yours. So, we'll keep it, just to the basics. And the other thing I'll say is that, I make a lot of YouTube videos and people are often commenting, oh, his voice is so soothing. I can fall asleep to his voice. Well, to me, Sina's voice is soothing. So I enjoy your speech and found it very nice to hear you speak. And the way you
Thank you
talk
so
about
much.
this work is truly incredible. So thank you. All right, let me share my screen. I have Oh, by the way, I have this up because we have a lot of videos on YouTube about PRP. So if anyone's interested in like learning more about it, especially seeing like more of it applied clinically, you can check those out. I think they're useful. And then can you guys see this screen with the M site?
Yes.
Okay. So, there's good data to support the use of PRP for hair restoration, going back like almost 13 years. Uh, there's been randomized clinical controlled studies, dating back to about that time. Initially for alopecia areata, which is actually the condition that I have. But then, as the years went on for androgenetic loss and some other hair like scarring alopecias as well. So, it's well supported by the literature. So it's definitely a category that we discuss often with patients when it comes to how to help them with their hair loss. But I think it's important to frame it in the context of like what else exists that we have also at our disposal. And, I realize, most of my practice these days is like hair surgery. A lot of people, they don't offer surgery, right? So they might offer some other aesthetic procedures and services, and then PRP is just something else for skin, for hair. Um, but I think it's important to know like when you maybe should refer out for something, like PRP is not a replacement for surgery. It's not a replacement for other things that exist for hair. So I think like one of the most important things to take away from this short talk is like how to conceptualize it and where to put it in the framework of what actually works and helps for hair loss, or at least the more common forms of hair loss. So I just wanted to start off with some general advice. So, like, this is not for everyone with hair loss, right? So, once you reach a point of more advanced hair loss, like I would say maybe Sina and myself, like, we are not the best candidates for PRP, right? It's just the way it is. So, you cannot offer it to everyone and expect people to be happy with results. So, you're looking for patients with more mild to moderate hair loss in general. And you have to kind of talk to them about the expectations. So again, not a replacement for oral medical therapy, which is really the first line. PRP, in my opinion, is not first line medical therapy, and PRP truly is not for androgenetic loss like preventative, right? In my mind, preventative medical therapy for men is like finasteride, minoxidil. For women, usually more spironolactone. Occasionally, we also use finasteride and dutasteride, though it's less effective usually. And minoxidil also isn't the most preventative at all. So, I think it's important to frame this, right? You've got like the preventative bucket. So that's finasteride, dutasteride, spironolactone. Then you have the stimulation bucket. And at the top of the list, in my humble opinion, just treating lots of people all the time for now 8 years, is oral minoxidil. I mean, that is really, I think of as the king. It's also the cheapest, easiest for people to consume, overall very well tolerated at a low dose for men and women, and truly can be quite impressive. Um, and then I think of a few in the second line for stimulation and PRP, especially proper PRP like M-site is very much on that second tier for stimulation. And then other options would be like low-level laser light or microneedling is another one when it's performed properly. So that's really how I think of it, at least in my mind. And then you have surgery. And surgery is when, you have, and again, surgery is not like the answer for everything either. We have a limited supply. Usually you need a depleted enough area. You need to have enough donor supply. You need stable hair before you do surgery. But of course, the impressiveness of the results, you cannot really substitute usually compared to most other medical therapies. So, but it's got to be used appropriately. So I think, and again, we've taken lots of pictures, like good pictures. If you go to my gallery for the actual surgery, you'll see it's like you can't really argue with like there was a change. It's the same lighting, the same angles, like all the good stuff that is actually pretty difficult to replicate, from before to after photography. But at least in the new space that I'm in for the last 2 years, we really put in a lot of effort to do that, to show people like true results. So when you do that for PRP, uh, more often than not, you don't get these like incredible transformations that if it's done properly and not just like a change of lighting, angle, you comb the hair the other way and all of a sudden they have a full head of hair. Like, that's not hard to replicate, and most of our literature is and pictures on Instagram are full of this type of stuff, including surgical results. But if we're going to be honest with ourselves, first and foremost, I think it's important to acknowledge that with PRP, we truly are not seeing like very radically transformative results, like when you look at photos that are well controlled. So I would just lower the patient's expectations on, especially from like a hair regrowth potential to like what you see here. I think you'll just have happier patients than if you promise them the world and then it doesn't deliver and then they want their money back. And there's also, it's important to define success because it's not just stimulating hair, but some people come in because they're losing a lot of hair. And even though PRP isn't truly, in my opinion, like a very preventative type of application, sometimes people don't want to be on medical therapy pill-wise, and some of them are not good candidates for different side effect reasons, whatever. So we have seen PRP be able to reduce some shedding in some patients, especially when it's not very severe shedding. So even the ability to just like reduce that hair fall and stabilize their hair to a degree, at least temporarily, can be seen as like a sign of like success and achievement and like that can be praised, right? So, I think it's good to frame it in that way so that they're not just expecting that it's going to be so much thicker than it was before when they came to you, but rather maybe it's just not going to fall out as fast. And maybe that's a good thing. And if you don't want medications, then maybe we just do this every few months. So I think that's important to establish with patients. And I just wanted to make a comment. I actually filmed a video recently. We just released it, I think, a week ago on PRF versus PRP. A lot of people have been asking us about that. And at least in my review of the literature, I didn't see any significant superiority data for PRF. But some clinics are marketing it more expensive. It's the PRP 2.0, all this stuff. I don't think so, but just know that it's out there and maybe it has some merit, but doesn't seem like it's all of a sudden going to be replacing PRP. Uh, and then we buy both kits, the 20 cc and the 60 cc. The 20 cc is what we use intraoperatively. Person already, they're losing some blood from a full day of scalp surgery. So we just kind of minimize that additional bloodletting, do a smaller draw. And, we're looking at this, PRP application. We do it for everyone for scalp surgery. We just include it in the pricing. We don't really charge extra for it. Uh, for facial work, like there's other transplants I do. We don't do it for every hair surgery, but for scalp, we do it. We find that it can reduce shock loss. So not the shedding of the transplanted grafts, they will still shed, that's normal. But the temporary loss, usually temporary, of the surrounding hair, like the native hair that you're transplanting next to, there's usually is like a temporary shock, but we find that we get a reduction in that shock loss with the use of PRP intraoperatively. And then it's also, like Sina was saying, anti-inflammatory in many ways, can promote healing, all good things for immediate post-op healing. And we do inject this now in the afternoons because I make my sites early in the day. And when we injected PRP right after that, we found that by the time we were ready to implant, because we have to then harvest the graft. So by the time we were ready to implant, some of the sites started to kind of seal up because it's healing, essentially, right? So we inject the PRP now closer to the time that we're ready to actually place the graft, so they stay nice and open, the sites. And then the 60 cc kit we use for kind of like post-op application. People sign up for this as like a package, an optional package. I just explain it to them as like, look, this is not a make or break on your final transplant results. You know, eventually it'll kind of come to the same place. But if you're looking for, you know, reduced like redness. Sometimes the skin can be pink for quite a long time after surgery. Uh, Usually that shock loss as it's slowly recovering, doing PRP at 3 months can help. We also see sometimes the regrowth occur at a quicker pace. Again, not always, but sometimes. So we do promote it. I mean, it's a kind of a business move in a way, but I've never had anyone regret it, and I think it's overall a good thing. It's just, you know, a little extra money, a little extra time for patients to come through for this, but many sign up. Maybe in our practice, maybe like a third will sign up for it. And then, of course, when we have patients who are just coming in for medical therapy, they're not surgical candidates, or they just don't want surgery, or they don't truly have great stability of hair for us to operate yet. We'll offer them this kind of 60 cc PRP, and it can be for different conditions: androgenetic loss, alopecia areata, LPP, telogen effluvium, you know, different for different causes of etiologies of hair loss. In terms of how to administer the PRP, when we do surgery, they're already numb essentially, so that's pretty easy. You just inject it once they're numb. And then when it's a standalone, we do believe in doing ring blocks for people. I know that there's folks out there who are like, well, I'm going to inject them with a needle anyway. What's the point of numbing? But in the past, I used to teach like how to do PRP to people at like local courses and stuff. And we were able to convince everyone to switch over to numbing people first. It's the more humane way to do it. Yes, it's needles to numb, but we're injecting PRP typically with 25 gauge needles, but we're injecting local anesthesia with usually 30 gauge needles, and it's a big difference. And if it's nice and controlled and you do it as like a ring, you don't have to go throughout the entire space. Just kind of understand where the nerves come in for the area that you're going to be injecting PRP, and just, you know, at the periphery, you don't need a lot of anesthetic to achieve a really nice block so that they're really comfortable for when you come in with the PRP. And then you're not like rushing with the PRP because they're miserable. So I think it's the way to do it. And then we do have a jet peel system with this, which is like high pressured air, creates like these little micro channels. And there's no numbing required. So for people who are like, who hate needles, that's an option. I actually did a small study on the use of jet peel with PRP now, like maybe 5 years ago. But yeah, that one we published, so that's the link there. But yeah, I mean, we find that the results are pretty similar between the two, which is good. And it's interesting. There was one of the hair conferences I was at maybe last year. Someone was talking about how they found that when they inject PRP more superficially, instead of like those deep injections where you're almost like on bone, but when they were almost doing like dermal injections, they were finding better results. I'm not sure that that's across the board true, but there was some, you know, I don't know, anecdotal stuff reported from a group, which was interesting because, you know, I know with the jet peel, the PRP is not penetrating too deep, but if maybe the superficial penetration is all you need, then it could explain why it's, you know, still working well. And then there's exosomes that we've started in the last 6 months that combine. A lot of people have been asking us for exosomes. So we said, okay, let's like research. I asked colleagues like who I trust, you know, who do high level dermatology practices with aesthetics, and you know, they seem to like this Exovex company. So we started buying their stuff, and we don't inject it because it's not like FDA approved. So we apply it topically after we're done microneedling after PRP. I don't see any additional benefit clinically, to be perfectly honest. But we charge a little more for that, and some people are very excited that they're getting the PRP. We don't do exosomes alone. We do PRP plus minus exosomes, but I haven't found it to be some groundbreaking thing. Maybe if it was injected, but we try to stay safe with the FDA. Frequency PRP we're doing every like we basically people sign up for like a package usually. If this is separate from surgery, we do it once a month times three, and then uh, we want to make sure that they've seen some benefit. If they like it, if they see that it's helping, we continue, and usually at that point we will continue every 3 to 4 months to inject at that interval, approximately. And then for monitoring, we used to do global photography for everyone, and honestly, because we weren't seeing too much of a change that was like easy to show patients, like, oh my God, look how great, it's coming along. We stopped taking global photography, and we offer this Tricolab. We have like this, it's a Polish technology, Tricolab. We actually had their big 3D system for surgery, and we found it to be useless, to be perfectly honest. So we got rid of the 3D, and then we just have the handheld for caliber detection of hair, for density. And it's just, honestly, we just ask patients, do you want us to track it? It's like there's these virtual tattoos to detect the same area. The hardest thing is like to come back to the same exact spot to then like months later be able to, because if you're just a little bit off, you could be detecting a whole different density, and then it's like, what's the point? It's totally useless. So, it's possible to be fairly accurate, but we feel like it's best if there's good buy-in from the patient. So if they are excited about tracking these numbers and they want to do it, then we do it, and it's fine. And sometimes it's nice to show that, hey, you may not see a huge difference, but like look at the numbers. There's a 5%, 10% gain of caliber or density, and that might convince them to keep going, but we don't require it. And many patients honestly are like, I'm not, I don't want to do that. Just like give me the PRP. So that's been our experience. I mean, I remember my mentor, Jeff Epstein, the hair surgeon, Jeff Epstein in Miami, who, taught me a lot of the stuff I know about hair surgery. And he was in the process of switching to M-Site at the time that I was under his mentorship, back in like 2018 to 2020. And really that's what got me started with M-Site. And then those local kind of courses, some aesthetic courses that I was helping organize in the early days in New York City. They also, the people organizing along with me, they were already using M-Site, and that's kind of how I got on the M-Site bandwagon. And I think you guys have been advancing the field nicely. And yeah, we just continue to use M-Site, and it's been good. That's, I think, all I got.
Thank you so much, Dr. Linkov. It's my
Sure.
pleasure having you with us.